I'm a pharmacist. I live in New Berlin, Wisconsin. I'm 42 years old. I live in my house with my wife, Ann, and our 3 kids, Vanessa, who's 14, Adam, who's 8, and Lydia, who's 6. And funny enough, I live in a subdivision where my mom is a block away.
Luke is a strong, hardworking man. He is a phenomenal father and is always interacting, involved in the kids' activities, helps around the house. He has a great sense of humor. He always makes me laugh.
Look at that. What a save.
When I was born, they had done some blood work and they found that my white blood cell count was extremely low, below the normal range, and also that my neutrophils were, so they right away knew that there was a problem. My name is Luke, and I have WHIM syndrome.
WHIM stands for 4 different terms, which are warts, hypogammaglobulinemia, that means low antibodies, infections, and a term called myelokathexis. It's a hypercellular bone marrow. A lot of immune cells trapped inside the bone marrow. WHIM syndrome is thought to be a rare inborn error of immunity. Families were found to have mutations in the CXCR4 chemokine receptor. What's happening is most of the patients, their mutations make that CXCR4 receptor hyperactive, meaning their immune cells can't get out of the bone marrow, where immune cells are made, to fight off infections in the blood. So patients then have recurrent infections. There can be everything from oral ulcers and gingivitis, bacterial pneumonias, to full-blown sepsis requiring an intensive care unit stay. Patients tend to be diagnosed later in life. Oftentimes, they are told that there is something outside of the normal range in their blood counts.
So the diagnosis is mainly made based on the white blood cell labs. Also, when you're older, they could do a bone marrow biopsy and they could pick it up on that.
It's only recently that we have been using genetic testing more commonly in the clinic.
I was first diagnosed with a blood dyscrasia, what they called, when I was 5 years old. And I was going in for eye surgery, and the anesthesiologist stopped because he had finally got the blood count and saw that things were way messed up. Many of the doctors that I've had to go to, they've all said they've never seen a blood picture like mine. The doctors at the time said that there's no way I could pass this on because they've never seen it before. Once I gave birth to Luke and they came back and told me that he had a blood dyscrasia, my heart fell apart. My brain didn't even know how to handle that because I thought I was the only one who would have to deal with it.
You have a 50% chance as a child to inherit the WHIM syndrome gene. So what we see is an autosomal dominant type of pattern where you only need one bad copy. But we certainly have found families where no parents have an abnormal gene and none of the siblings.
Luke and I were definitely afraid that our kids would have WHIM syndrome. All 3 of them had normal white blood cells when they were born, so we really thought we had dodged a bullet and were blessed that all of our kids were healthy. When Adam was 5, they were doing a routine blood test for asthma, and that is when we found all of his counts were abnormal, and we were definitely shocked and surprised and very scared for his future.
We are definitely learning more about WHIM syndrome and how family members within the same family with the same genetic mutation can have differences in disease expression. And I think that that is one of the big mysteries of WHIM syndrome.
In my case, I have a variation of it. So instead of WHIM, I have WIM, WHIM syndrome. And because I'm missing the low immune globulin component, my immune globulins are at a normal levels. I didn't have any WHIM issues as an infant, but as a toddler, when I grew up a little bit older, then I was showing signs and symptoms. I did have a slew of infections and illnesses that were higher in frequency than normal kids. Also, as a kid, like cuts and scrapes would lead to skin infections and cellulitis.
I had to follow him around, make sure he wasn't going to fall down the stairs, make sure he washed his hands, make sure he didn't go barefoot and step on something like I had done in the past and got an infection.
When I was about 8 years old, I had a compound fracture. This is the scar from when they had to open my arm up because of the compartment syndrome and infections and inflammation. Also, further down on my wrist, I have a scar here. That is actually when I was a child, I had a wart that was removed.
He's had them all over his legs, had to have them surgically removed. I've had plenty that I've had surgically removed.
So I do think the warts piece is something that, although not all patients have, it is a risk factor for cancer, and it definitely affects how they function in daily life.
I've also struggled with horrendous canker sores in my mouth, making it very difficult to eat. So far, Adam and Luke haven't had those yet, but they have other things that come upon them.
When Luke first told me that he had WHIM syndrome, I really didn't think too much of it because he appeared normal on the outside. It didn't seem to affect him in his work life or personal life too much. But as I got to know him a little bit more and started to know that when he got sick hard and fast, I think it kind of started to resonate that this was a little more serious and something definitely unique about him.
As an adult with WHIM syndrome, I have chronic fatigue, and I feel like I need a lot of rest, maybe more rest than other people my age. I've also had a lot of missed days of work and activities due to illnesses. I'll get like 4 to 6 really good colds or flu during the winter months especially. I also have to go see a periodontist and a dentist every 3 months to make sure that my teeth stay clean. Basically, I have to stay on top of it, otherwise I'll lose my teeth.
We're definitely concerned about what Adam's going to have to go through. Adam is having low IVIG counts, and that's something that neither Luke or Jennifer have had to deal with. And that's something unique to him, but not unique to WHIM syndrome.
WHIM syndrome definitely can be a very deadly disease if you get into a situation.
When new viruses come around, it definitely makes us fearful that something more severe could happen.
Several years back, my mom was hospitalized with H1N1 flu. She ended up being hospitalized in what I would call life support. They had basically thrown every treatment at her that they possibly could to keep her alive. So it can definitely turn deadly very quickly. WHIM syndrome definitely can be a sneaky disease. You can go from a completely healthy person, everything's fine, to the next second you're preventing a crisis. A good example of that I can think of is I was on a family cruise somewhat recently, and I ended up kind of like puncturing my foot. With WHIM syndrome, it's very easy for it to get infected rapidly. I was seriously debating if we should continue the cruise, but I was able to get off the cruise ship and get antibiotics after the vacation was over. But it was a close call.
WHIM syndrome cannot be cured. It is a genetic disorder, and we ultimately cannot currently change the abnormal gene. We can affect the protein's function. We can also manage the patient's symptoms by treating infections when they arise, working with dermatologists to help with HPV, vaccination to prevent cervical cancer, as well as other HPV-related malignancy. We can use immune globulin replacement therapy for patients whose antibodies are low.
And then also behind that is antibiotics. So it's kind of a 1-2 punch. You're stimulating the bone marrow to make white blood cells to fight infection, and then you have the antibiotics that will directly attack like bacterial infection.
We can support that patient by treating their infections, by making their supporting medical community aware that they have an immunodeficiency, And we have other types of innovations now where if a patient has low antibodies, to improve their neutrophil counts, their lymphocyte white blood cell counts, and to reduce infections, including warts. That being said, I do think patients get a lot of support from each other.
For example, I'm on a Facebook group where people have chats going on where they talk about WHIM syndrome. I felt that that's been helpful.
The Immune Deficiency Foundation and the Jeffrey Modell Foundation are more centered in bringing patients with inborn errors of immunity and advocating for them and bringing more research and attention to them. So I think finding groups like this, both patient-driven as well as foundation-driven, can be helpful for patients.
Making a shot.
There we go.
Both my husband and mother-in-law have lived overall healthy lives, and it's encouraging to see the success that they've had and the medical care that they've received that I know my son will also be equally taken care of.
I am hopeful for the future. I think that WHIM syndrome patients have more available to them than we have had previously. And I think more people are learning about their disease, and therefore hopefully doctors will be more aware so that hopefully we can identify individuals when they are young before they're symptomatic.
Coping with WHIM syndrome can be difficult. I think a lot of times it's having a positive attitude and being tough and going forward with your life and not letting WHIM syndrome hold me back. Especially for my son, I want to make sure to show him that you can live a normal life with WHIM syndrome. That helps give me strength moving forward.